I am a registered nurse and I have been assaulted at work more than once. I will probably be the victim of a violent assault frequently throughout my career. The fact is, 1 in 4 nurses are assaulted on the job, according to the American Nurses Association. Lynn Truxillo was a 56-year-old nurse working at Baton Rouge General Medical Center in Louisiana. On April 4th, 2019, she witnessed another nurse being attacked by a patient, and she quickly stepped in to help. That's when 54-year-old Jesse Gilroy turned his attack onto Lynn. Frightened, she tried to run away, but Gilroy grabbed her by the back of the neck and slammed her head downward into the corner of a desk. During the attack, Lynn also tore her ACL. She went to the emergency department where she was treated and released, but returned days later unable to breathe. You see, Lynn had developed a blood clot in her leg and in both of her lungs, which led to cardiac arrest. Lynn died 5 days after her initial attack. This attack took place right at the nurse's station in a busy hospital where Lynn had worked for 17 years. Patients who commit acts of violence against nurses and other healthcare workers should be criminally prosecuted. Workplace violence can happen anywhere. Yet of the 25,000 annual workplace assaults that occur in the U.S., 75% occur in healthcare settings. Sadly, only 30% of these assaults are reported by nurses. This is because incidents of violence against nurses has become commonplace. Offenders rarely get prosecuted, and hospitals often refuse to support their nursing staff and may even retaliate against them. No one should have to accept workplace violence as part of the job. Nurses deserve to be protected. Policy needs to be changed to punish offenders and deter behavior. Workplace violence is a real fear for nurses and healthcare workers, so let's review why it happens and what we can do to reduce incidents and protect our nurses. There's a disproportionate number of workplace violence against nurses and healthcare workers. According to a study done by the Occupational Safety and Health Administration, or OSHA, between 2002 and 2013, incidents of serious workplace violence were 4 times more common in healthcare settings than in private industry. National Crime Victimization Survey showed that healthcare workers had a 20% higher chance of being victims of workplace violence than other workers. The healthcare industry is becoming one of the most dangerous places to work in the United States. A 2016 study entitled Workplace Violence Against Healthcare Workers in the United States, published in the New England Journal of Medicine, stated that 46% of nurses had experienced workplace violence in their 5 most recent shifts. So why are nurses at a higher risk for violence and abuse compared to other professions? One reason may be the people that we interact with on a daily basis. Many patients suffer from mental disorders, dementia, delirium, or substance abuse. Then there's the healthcare culture that is resistant to believe that providers are at risk for patient-initiated violence, along with a complacency that violence is just part of the job. The broken window theory is a community justice theory that believes ignoring or tolerating low-level crime leads to an environment that's conducive for more serious crime. And this is what's happening in healthcare today. Finally, we have underreporting. Nurses take so much abuse from patients and family members on a daily basis that they've just become resilient. Add to that the lack of support they receive from their employers, and assaults do not get reported. If a nurse is seriously injured and does file a complaint, she may face retaliation from her employer. Healthcare workers who are victims of serious violence often get accused of doing something wrong themselves. According to the 2005 study in the Journal of the Society of Occupational Medicine, providers are sometimes uncertain what constitutes violence, since they often believe that their assailants are not responsible for their actions. You see, perpetrators are often diagnosed with psychosis, dementia, or they're under the influence of drugs and alcohol, and providers believe that they're not in full control of their faculties. Yet if you were walking down a public street and were attacked by an intoxicated person, you would still call the police and press charges, right? Violent behavior is unacceptable in American culture and in our legal system. So what can we do to utilize the laws that are already in place and provide better protection for nurses? One solution is policy change. OSHA has guidelines in place to reduce the risk of workplace violence in healthcare settings, but they're voluntary. The Joint Commission has vague policy requirements regarding workplace violence, but they're open to interpretation. Legislation that makes battery against healthcare workers a felony offense should be considered by all states to protect these vulnerable providers. Some states already have these laws adopted and in place, but we need all 50 states to participate. Legislators should consider enacting harsher punishments for violence against healthcare workers as a special class of offense. All states made it a felony to assault a police officer, a firefighter, an EMT, or a paramedic, but not nurses. Finally, we need prosecutors who are willing to enforce the protection laws that are in place and prosecute offenders. The only way to protect healthcare workers is to create stricter guidelines and a national policy on reporting abuse. We need to pass legislation for felony charges and stricter punishments, and we need to follow through and prosecute the offenders of violent crimes. There needs to be zero tolerance for serious physical assaults. Remember, 1 in 2 nurses will be violently assaulted in one of their next 5 shifts. We must have consequences for violence and assaults against nurses and healthcare workers. Perpetrators of serious violence against nurses should be criminally prosecuted and punished. Lynn Truxillo was a dedicated nurse. She dedicated her entire life to helping others. The night that she was attacked, after she was released from the emergency room, she went back to her unit and finished her shift. Nurses like Lynn deserve our protection and deserve justice.